everyone. Greetings, everybody. I'm Pooja from the beautiful Spotless Skin team, welcoming all of you all to this amazing Insta Live session where we're going to be talking about something which is really burning in all our minds and our lives. We're talking about acne management. Clearly, this is one issue that has been affecting many of us and millions of people worldwide because this is one issue that everyone is dealing with changing lifestyle, with a lot of issues happening, but we have a fix for it. Acne is not merely a surface issue, it can deeply impact one's emotional well being. It can erode somebody's self confidence, leading to anxiety, depression, and even social withdrawal at times. Acne vulgaris, specifically, is a condition, a chronic one, that is affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, of course, today there is widespread misconception about acne and its management. A lot of stigmas where people look down upon you that, oh my God, you've got acne, you've not been eating right. And there is so much that's happening that we are going to be breaking amidst today's live session. This session aims to give you all your answers related to acne and your worries. Today, we're going to be diving deep into this topic of acne management with our skin expert herself. Whether you're struggling with breakouts yourself or simply curious about how can you maintain a clear skin, we've got a solution for you. Today, we are honored to introduce Dr. Sumiti Pareek, a renowned skin expert from Jaipur, with us today. She's a distinguished dermatologist, cosmetologist, and venereologist based in Jaipur. She's renowned for her expertise in the field very clearly, with an MBBS from Government Medical College, Kota, and an MD from Sardar Patel Medical College, Bikaner. She has established herself as one of the leading dermatologists in Jaipur. Dr. Pareek's clinical practice at Shantam Skin, Hair and Laser Clinic is complemented by her significant contributions to academic research, earning her national and state level accolades. She's been presenting this topic across nationwide and clearly has won so many accolades for it. Her published work is reputable and is known in multiple medical journals that reflects her dedication to advancing dermatological knowledge. With a commitment to patient care clearly and the continuous learning, Dr. Sumiti Pareek is a trusted name in dermatology today. Today, Dr. Sumiti is going to shed light on a lot more about how she deals with her patients, how does she enable care for them, the knowledge and experience is what we're clearly looking forward today, and how she's passionate about even educating her patients. That's clearly what she strives for, and she's empowering them with information on how can these patients really go ahead and take care of their skin and hair. Today, we're privileged to have her amongst us, and let's start sharing more insights on this topic of acne and its management. We extend our heartfelt gratitude and welcome, Doctor. Thank you very much for
Thank you so
joining us.
much. Thank you. Thank you. Thank you for inviting me.
Thank you so much. It's truly our honor, Doctor, to have you amongst us. And with so much that you already have in store, we can't wait to start this live session discussing a lot about acne. So, Doctor, my first question to you, because I really want to boil down to the topic straight. Does it mean that acne can be different for different types of, face and skin? Is it like the lesions are different? What is it like?
So yes, definitely, lesions are quite different. So there are different types of lesions which can occur in acne. So they can be non-inflammatory lesions such as comedones. They can be open comedones, which are commonly known as blackheads. There can be closed comedones, which are commonly known as whiteheads. Then there can be inflammatory lesions such as papules, pustules, nodules, cystic lesions may occur. So yes, different lesions may occur in different people, and the picture of acne, it can vary from patient to patient. So yes, that usually happens.
Okay. So, doctor, when it comes to lesions, I got your point. But what about different areas on your face? Is it like different acne on different areas of face? Does that have any correlation?
Yes. So basically, if you're getting acne along your hairline or on your temples, then it could be related to the hair products that you're using. So it could be because of maybe some hair mousse you're using, some hair oil that you're using, or maybe some hair gel. If you're getting acne in your T-zone, your T-zone usually has the oil glands that are bigger than the rest of your face. So it could be related to excessive oil production on the skin. And if you have acne on your cheeks, then it could be because of continuous friction, as a result of lying on one particular side on your pillow, or constant use of phone. That could also lead to acne, friction related acne. And if you're getting acne, most importantly, if you're getting acne on your chin or along your jawline, then that could be related to hormonal changes, hormonal disturbances.
Okay. So, doctor, just one question that came to my mind. I understood T zone, the jawline, but what about acne on the nose? I mean, I've seen people getting acne on nose as well. Is that also something related to anything in the body?
Not really. So acne on nose, it is a very rare occurrence, but in people who have really prominent or large sebaceous glands, so in those people, it may occur in rare situations, even on the nose. So yes, that may occur, but there's no specific correlation as such.
Okay. Okay. Sorry, one more question, doctor, because this is really engaging and very informative. I've also heard that sugar intake also leads to acne. Is that even true?
Yes, that is true. Sugar, it basically leads to insulin spike in your body, in your blood. So it leads to more formation of insulin-like growth factor, and that insulin-like growth factor is responsible for increased keratinization, that is increased blockage in the openings of your sebaceous glands, in your oil glands, and that in turn leads to acne. So yes, sugar is a major trigger, a major aggravating factor in people who have acne. So yes, definitely.
Wow. Okay. So, all my viewers, insight on sugar intake has to be in control to get that acne out. Doctor, what about packaged food? Is that also got anything related to your face? How your appearance could be? Anything related to that?
Yes, so definitely packaged food, fried food, fast food, foods that are that have a high glycemic index, all these foods may trigger acne, may aggravate acne. So definitely, I recommend that patients consume home cooked meals that are completely healthy, and definitely diet has a role to play in acne pathology. So yes.
Okay, great. So, when we're talking about diet, doctor, I really am admiring your skin. Can you shed your daily routine? What exactly do you do to take care of yourself?
So, first of all, lifestyle is very important. So, make sure that you exercise regularly. Make sure that if you want to have a healthy skin, make sure that you eat healthy. So, diet is very important. And I try to avoid dairy products. I try to avoid sugar as much as possible. And other than that, I try to keep my skincare very simple. So, that is something that I keep telling my patients. With the advent of social media, people have this misconception that you need to put a lot of products on your skin, but that is not true. If you want to maintain a healthy skin barrier, as far as a dermatologist perspective goes, less is more. So use products that work for you and do not complicate your skincare. So that is what has worked for me and has worked for most of my patients.
Lovely. So less is more, my viewers, especially joining on Instagram. There is so much happening on Insta. I see every day there's a new serum that's coming up, from hyaluronic to niacinamide to vitamin C, glycolic. I mean, there's just so much out there in the market. I even saw the snail serum, which is very popular. And I know people are just picking up different products every day to just get that beautiful flawless skin. But as doctor said, less is more. Maybe those serums are essential, but let's get the advice right from our doctors to understand what is really required for your skin. Great. So, doctor, moving on, I also heard that there are different grades of acne. So, what is this really like?
Yes, when a patient comes to us, we basically evaluate the patient and we grade the acne, because the treatment also changes according to the grade of acne the patient has. So there's grade 1 acne, which consists of predominantly comedonal acne, whiteheads or blackheads, and some papular acne. And then there's grade 2 acne, which is comedones, papules, and some pustules, that is pus-filled acne lesions. Now, then there's grade 3 acne, which has pustules and some cystic lesions, and grade 4 acne, which has numerous and confluent cystic lesions, severe nodulocystic acne. So, yes, these are the grades of acne, and this is how we grade acne in our practice.
Great. So we just spoke about how we treat acne, doctor. So I understand acne is not going to be there with you for the lifetime, but I also see people suffering from acne scars. So are we trying to say that the treatment is going to treat acne, or the treatment would treat the acne scars? What is it like?
So actually, when we advise our patients to seek prompt treatment, that is because we want our patients to prevent formation of acne scars. Because once you get acne scars, then medical treatment does not really work. So if you have already developed acne scars, then no cream will work, no tablet will work, no face wash, sunscreen will work. You'll have to get procedures done. So as far as medical management or medical treatment goes, it only manages the active acne lesions. It does not work on scars, and for scars, you usually have to get procedural treatments done.
Right. So, doctor, you just mentioned about procedural treatment. So, what are those procedural treatments? If you can just enlighten us with that, please.
So, if we talk about procedures that help in management of active acne lesions, we usually perform comedone extraction in our clinic. We do chemical peels, which help with active acne. There are various chemical peels such as salicylic peel, mandelic peel, so great options for acne management. And then we do intense pulse light and even lesional injections, intralesional triamcinolone injections in people who have nodular cystic acne, severe nodular cystic acne. And as for scars, we perform micro needling, MNRF micro needling with radio frequency. We have fractional CO2 laser. We have subcision, radio frequency subcision, scar excision. So a plethora of treatment options are available. And the treatment, it has to be customized according to the needs of the patient. There's no one size fits all in case of dermatology, in case of medical science. So you have to evaluate the patient and then formulate a treatment plan for your patient's specific needs. So, yes.
Okay. So, doctor, what I hear is there are multiple treatments available, but I know that my viewers would be scared to undergo treatment per se. I mean, what they usually do is just going over the counter with an acne ointment or a tropical thing, and it doesn't work, and we just struggle with it. But treatment just sounds very scary, and I don't know if you can just shed light that these treatments are safe, whether they cause any sensitivity to the skin, and what really happens after the treatment.
So, definitely dealing with acne is a difficult situation. And the path of acne treatment, it is also a long one. It can be tiresome in patients because often we have to put our patients on treatment for, prolonged durations. So, I won't say that it is an easy path. It is a difficult path. Most of the acne medications, they have an irritant potential. So definitely patients' skin also get irritated in the process. But if you take your treatment under the guidance of a dermatologist and you're constantly in touch with your doctor, and your doctor is always there to answer your queries, to address your problems along the way, then the journey definitely gets easier. So yes, there can be side effects, but there's constant monitoring that a dermatologist usually does. We go for routine blood investigations, and we also evaluate our patient's skin in the clinic, and then we make a very informed decision, a decision that is perfect and that is suitable for our patient. So yes, so if you are in touch with a dermatologist, if you're taking these medicines over the counter, then yes, they may harm you because you may not know when to stop, how much to apply, when to apply it. But if you are using these medicines under the guidance of a dermatologist, then they can do wonders for your skin. And I have seen patients whose lives have been transformed after their acne treatment, and their confidence, was boosted, many folds after the treatment. So yes, if you take the treatment under the guidance of your dermatologist, if you're constantly in touch with your doctor, then definitely these treatments do you more good than harm.
Clearly. So, I mean, I can just advise my viewers to reach out to the doctors and don't be worried about what treatment could do what. Let your doctor decide, and really trust them to do the best for your skin. Doctor, another question that's just coming up in my mind as we're talking that, normally when a person gets acne, like even for that matter myself, if I get one acne, I may just probably try doing something at home, right? Like how our moms and dadis have said, honey laga do, chandan laga lo, and all of that. Those are those specific call outs that they say कि doctor के पास क्यों जाना है acne के लिए. And
Mm-hmm.
when is it that my viewers should really take their acne seriously? एक acne हुआ है चला गया फिर आया चला गया. When is that time when they can decide that no, this is something different? What is that
Mm-hmm.
trigger that they should really look
So
at?
basically, this is very important to acknowledge that the decision of when to approach a doctor, it may vary from patient to patient. Okay, so one patient might get worried about a single acne, and it might affect the patient's mental well-being. So if it is doing that, then even for a single acne, it's okay. It is justifiable to approach a doctor. But
Yeah.
uh, also, I would like to make the statement that it is okay, especially in case of female patients, it is okay to get one acne before your menses because you're constantly undergoing hormonal changes. It's okay. It happens with all of us. So it's okay to get one acne or occasionally two or three acne before your menses. So that is not something that should raise an alarm. But if your mental well-being is getting affected by a single lesion, then it is completely justifiable to approach a doctor. At the end of the day, you should feel good about your skin. You should feel good about stepping out, about talking to people, interacting with people. And if your confidence in that regards is getting hampered anyway, then you may approach a doctor. You may approach a dermatologist. It's completely justifiable.
Okay, great. Doctor, we do have some questions coming up in the chat window. The question is from Firoz, and he says, can hair products contribute to acne? I think you fairly answered the T zone area, but if you want to just highlight that.
Yes, yes, definitely. Hair products can contribute to acne. So if you're using a very thick mousse or very heavy oils, like in India, people have a special affinity with mustard oil or even coconut oil or heavy oils. So that may definitely clog your openings of your oil glands, and that may lead to acne. And even with the heavy hair mousses, hair setting sprays, and hair gels, pomades. So all those things may trigger acne.
So, Firoz, if you're using hair products, use it in moderation. That's what we can say. Thank you, Firoz, for asking that question. Another question from Ankita, doctor. She says, is there a link between acne and thyroid?
So there's no particular or link between acne and thyroid. But when a patient is experiencing very persistent and very stubborn acne, we usually order for a hormone profile, and we usually also order for thyroid profile in that case. But there's no particular link. Like you could be a patient of hypo or hyperthyroidism and still not have any acne. So there's no particular link as such.
Okay. All right, Ankita. I hope you got your answer. Another question from Shweta, doctor. She says, what should I do if my acne worsens with the treatment?
Okay, so this is a very nice question, and this is something that needs to be answered by an expert to raise general awareness. Yes, in case of some very potent acne medications such as isotretinoin or even topical retinoids, in the first few days, your acne may worsen because this is how these medicines work. So they basically increase the skin turnover rate. So the duration which a skin takes usually to form and then finally shed, that duration shortens substantially with these acne treatments. So all the gunk which is under your skin surface, it will suddenly come together uh, on the surface altogether, and it will give a perception of worsening of acne. But you have to be patient, and you have to be in touch with a dermatologist. If you're apprehensive, if you're scared, then you are just feel free to ask your dermatologist all these questions, and I think your doctor is liable to explain all these things to you and in simpler language, in language in which you can understand it. So that happens. And if still after a few days your acne does not settle and your skin is in a very bad shape with all the acne medications, then your doctor would probably make the decision to shift onto an alternative medicine or onto an alternative treatment modality. So, yes, stay in touch with your doctor, and I'm sure that your dermatologist will make a very nice decision for you, uh, a decision that is in your best interest.
Right, absolutely. And thank you very much, Shweta, for asking that question. And clearly, there are a lot of patients who probably give up during the treatment phase also, imagining as you said, in the initial phase it would give me more acne, and what if I lose the confidence on the doctor saying that, oh my god, this is just worsening up, and I don't go ahead with the
Yes.
treatment. So it's
Yes.
essential that we know that it can probably have a reverse effect, but it is all for the good. So just stay patient. Great. Doctor, another question that's coming up is, how should we really deal with acne in sensitive skin? Is there some different treatment altogether?
Yes, if you have extremely sensitive skin, so sensitivity is also a spectrum. Some patients might tolerate some particular medicines, when we prescribe topical retinoids, tretinoin is in the rage these days. So people with sensitive skin, they might not tolerate tretinoin, but we have something called adapalene, we have something called trifarotene, which people might tolerate. But if you have an extremely sensitive skin, you might not tolerate any retinoid at all. So in those patients, we can go for options such as benzoyl peroxide combined with clindamycin or rosuloxacin. So yes, there are many treatment options. There are many topical and oral medicines that people with sensitive skin can be prescribed and they can tolerate. And another thing that people who have sensitive skin, it has to be made sure that the patient is using a very nice moisturizer which also has calming ingredients. So with the use of moisturizer and sunscreen, definitely the patient tolerates all these medicines better. And even in people with sensitive skin, it is possible to treat acne.
Right, absolutely, doctor. And you just mentioned about moisturizer and sunscreen. So, what is the regular maintenance that my viewers can follow when it comes to taking care of their skin?
Okay, so if you are struggling with acne and you're not sure about consulting a dermatologist as of now, so that then something that you can do is, if you have a very oily skin, then you can use an AHA or BHA based face wash, a face wash that has salicylic acid or glycolic acid or mandelic acid, something like that can be used. For oily skin people, they can use a gel based moisturizer and a gel based sunscreen, and they can incorporate maybe a niacinamide serum in their skincare routine. For people with dry skin, I would suggest that they use a very gentle cleanser. So there are a lot of nice gentle cleansers in the market. So gentle cleansers with cetera alcohol ingredients such as cetera alcohol, which are very mild surfactants, very mild cleansing agents, those can be used. And other than that, a nice creamy moisturizer with ceramides can be used, because when your skin barrier is compromised, that may lead to further acne. So, a nice moisturizer with ceramides or oat extract can be used, and a nice emulgel sunscreen can be used in people with dry skin with acne.
Okay. So, doctor, I think there's a lot of conversation about sunscreen specifically, and there are so many available in the market, and there are different formulations also available. So, imagine somebody who's dealing with acne. I think you mentioned gel based sunscreen basis, skin type and stuff. But are there any star ratings that they need to look at, and different formats of sunscreen? If you can really highlight that, that'll be really helpful.
Yes, definitely. So, if you're struggling with acne, then sunscreen becomes even more important because sunscreen definitely protects you from the sun and protects you from the inflammation that could be triggered by the sun. So, it protects you from acne, it protects you from post-inflammatory hyperpigmentation that could occur after acne. So, if you're using sunscreen, then make sure that if you have acne and oily skin, you use a gel-based sunscreen which is at least SPF 30 and PA triple has a PA triple plus rating. So to make sure that your sunscreen is actually working for you, you have to
Yeah.
ensure that your sunscreen, is up to these two parameters. And if you have dry skin, then again, I already mentioned emulsion sunscreen with 30 SPF, 30 SPF rating and PA triple plus rating should be used.
Perfect. I think we got your answer. And there's another question that is quite relative to what you just answered, Doctor. Priyanka is asking if there's any specific skincare considerations for oily skin. I mean, I know you mentioned about the sunscreen. Anything specific for the moisturizer or anything else that you want to highlight for oily skin?
Yes, if you have oily skin, then there are a few things that you need to take care of. First of all, I see a lot of people using a lot of heavy creams when they have oily skin. So try using a lightweight gel-based moisturizer if you have oily skin. And another mistake that people with oily skin usually make is skipping moisturizer. They're like, my skin is already very oily, so how do I need a moisturizer?
Yeah.
So that is not how skin works. When you do not put moisturizer on your skin has a brain of its own. So So it figures out that your skin is in need of a moisturizer. So it produces more and more oil. A feedback mechanism comes into play, and it produces more and more oil, and it leads to further production of oil, further aggravation of acne. So use a moisturizer, make a point to use a moisturizer. Another thing, another mistake that people with oily skin usually make is over washing their face. They have a tendency to wash their face 3 and 4 and 5 times. So that again strips your skin of all its natural and essential oils, and you end up with a damaged skin barrier, which worsens your acne. So for people with oily skin, these two things are something that I have experienced in my practice, that people have a tendency to make mistakes about these two things very commonly. So definitely, I would suggest that you take these things in mind, keep these things in mind, and use your face wash only twice every day. And every time you wash your face, make sure that you apply a thin layer, even if a thin layer of moisturizer, but make sure that you apply moisturizer. And definitely, there is a right fit of moisturizer for everyone. If you're not able to find that out, if you're not able to figure that out, please consult your dermatologist, and your dermatologist will help you.
Clearly, wow. I'm glad Priyanka asked this question. So भले ही ऑयली स्किन है, ऐसा नहीं है कि मॉइस्चराइजर नहीं लगाना है, आपके पास अंदर ऑयल्स हैं पर मॉइस्चराइजर की जरूरत है आपको, एंड बार बार मुंह नहीं धोना है. That is not a solution for your oily skin. There is a way you treat it and deal with it. Great. Doctor, another question from Pooja, and she says, fairly you've answered this question as well, but how do hormonal fluctuations affect acne?
Yes. So, hormonal fluctuations. So, we'll talk about the most common hormonal problem that is, extremely prevalent these days. It's PCOS. So, what happens in PCOS, that is polycystic ovarian syndrome or polycystic ovarian disease? There are tiny cysts in your ovaries which produce androgens. So, androgens are basically male hormones. So, these androgens, they have a tendency to block your oil gland openings. So when your oil gland openings are blocked, there is inflammation, there is proliferation of bacteria, acne होगा, acne है तो वो worsen होगा. तो definitely hormonal fluctuations जब होते हैं, जब हमारे female hormones जो होते हैं, उनके साथ साथ मेल hormones भी बहुत ज्यादा excess में बढ़ जाते हैं. मेल hormones जो हर female की body में produce होते हैं, पर एक check में रहने चाहिए. तो जब वो नहीं रहता, and the male hormones are produced in excess, then they can lead to excessive keratinization. They can lead to blockage of your oil glands, and then eventually lead to acne, worsening of acne. So yes.
Great. Doctor, I don't know if I'm digressing from the topic, but this was really interesting that you mentioned about the hormonal fluctuation happening. What I also feel is, doctor, the treatment has to be internal. Understanding कि अगर hormonal fluctuation हो रहा है तो क्या हम कोई medicine से उसको balance out करते हैं कि acne ना हो, क्या करते हैं, और क्या कोई diet changes करने होते हैं कि hormonal fluctuation ही balance हो जाए?
Yes, in some situations, medicines are necessary. Medicines definitely help in some patients who have very severe acne and who have been struggling with them. Then there are medicines to keep these hormonal fluctuations under check. But that doesn't mean that lifestyle modifications are not important. They are of paramount importance in this case, even more important than the medicines. So definitely, आपको ध्यान रखना है. You have to work out every day. You have to have a very healthy lifestyle. If you have a sedentary lifestyle, if you have a desk job, that means you have to make sure to move every few minutes or hours. And another thing is that you have to consume a very healthy and a very balanced diet, and avoid fast food, avoid dairy products, avoid sweets. So anything that can mess up your hormonal cycle. So you have to avoid avoid those food items. So lifestyle modification is, in my view, more important than medicines in case of hormonal acne. So
Okay.
yes, that is important.
Okay. Clearly, doctor, I think I've been speaking to so many doctors throughout this month, and everything boils down to lifestyle. हर इशू जो हमारी बॉडी में हो रहा है, कहीं ना कहीं हम क्या खा रहे हैं, कैसे रह रहे हैं, everything is required. And I think, as you mentioned about obesity as well, everything is triggering down to one or the other issue. So just make sure that you're having a healthy lifestyle overall to deal with most of the issues. And if you're still dealing with issues, of course you have doctors to deal with it. Doctor, another again very insta generation question. We all want makeup today. So is makeup really worsening acne?
So yes and no. Certain makeup products may worsen acne. So if you're using a very heavy foundation, a full coverage foundation, which does not have a non-comedogenic preparation, then it may worsen acne. But if you're using the right products and you're making sure that you're taking off your makeup every day before going to bed, you're cleaning your brushes regularly, then no, you may wear makeup without worsening your acne. So people usually think that just washing their face after putting on a full face of makeup is enough. So that is not the case. You have to emulsify your makeup, emulsify all your makeup products with a cleansing lotion or a cleansing balm or a micellar water, then wash your face and then go to bed. So if you practice that religiously, and every time you put on your makeup, you make sure that you take it off completely. You wash your makeup brushes and beauty blenders regularly, and you change them regularly, then definitely you can wear makeup even if you have acne, even if you have previously struggled with acne without worsening or triggering your acne.
Right. So wearing makeup is not a no-no. You can have it, but make sure you're using the right products. Maybe a full coverage foundation is not something that you should do with. But doctor, this is another problem that most of my brides are facing, especially with multiple functions happening one after the other. They're like, we can't do away without makeup. So any tips for my would-be brides or anything that they should be doing to take care of their skin?
So it's okay. Your wedding is a big day, and everybody wants to look nice on their wedding day. So I don't think that you should necessarily refrain from wearing makeup on your bridal functions. Just make sure that your makeup artist is using clean brushes, and just make sure that you're taking your makeup off after the event. And it's okay. It's okay to indulge in makeup every now and then. And at the end of the day, what you're doing should make you happy. And if it is making you happy, then it's all right. Just make sure that you're doing it the right way.
Right. Right. So my would-be brides, you can get that makeup on. Don't you worry. Enjoy your wedding functions, but you need to ensure to get the makeup off and follow your cleansing, toning, moisturizing, as doctors mentioned. Ensure that you're having a good, healthy skincare routine and your sleep routine. Great. So I think the conversation is so interesting that we're having multiple questions coming up in the chat window. Ahana says, "Can probiotics help with acne?"
Yes, there have been studies which have linked gut health with acne. So, having a healthy gut, it can definitely help with acne. So, probiotics, yes, there have been studies. There have been a few studies which have suggested that the use of probiotics could help reduce acne. But just make sure that you're not using the popular probiotics which are laced with sugar. So just make sure that you're using the right probiotics, that you're maybe consuming yogurt or dahi or fermented food, and not going for those probiotic drinks that have a lot of sugar in them. They will do more harm than good. So yes, probiotics can help with that.
Okay, great. Doctor, another question. Vanya, this question is actually answered by doctor because Shweta had a similar question. What should I do if my acne worsens with treatment? I think Vanya could have joined in late, which is why she probably missed the answer.
Vanya, just be patient. That's all I would like to suggest. That just be patient. Your acne, it will improve with time. But just be patient. Stay in touch with your doctor and trust your doctor. Trust the process. And it is completely normal for acne to worsen in the first few months, first few weeks, maybe a month, maybe 2 months. It's absolutely normal, and it happens to the best of patients. But your acne will definitely settle.
Right, Vanya? Don't lose hope. Stay patient, as doctor mentioned. Another question from Khilan. I don't know if I'm pronouncing it right, but should I use a toner if I have acne?
I do not have very nice things to say about toners. So I think they are absolutely redundant. They are not needed, and most of these toners are burning a hole in your pocket. I would suggest that you rather invest your money on a consultation with a dermatologist if you have acne, and take medicines that have been proven to work for acne. And toners are not something that are needed. Why complicate your skincare with redundant products? Use products that are actually needed for your skin, and invest money in the right things.
Right. Absolutely. Doctor, you were speaking about toners being a burning hole in your pocket. And I remember in my early days when I spoke to the doctor, and doctor said कि अच्छा पैसे खर्च नहीं करने, rose water लगा लो, वही toner बन जाएगा.
Mhm.
At least that is your easy pocket friendly way to tone your skin if you really want it. But yeah, that's
Yes.
probably one of the things that I did. I don't know if I did right. I don't use it anymore, but yeah, I started my skincare long back with that. Okay, Doctor, one very interesting thing that came to my mind right now. I have a friend who doesn't use skin treatment at all, like no moisturizer, no sunscreen, nothing. But it's a male friend, okay? So males are like, oh, we don't need moisturizer and sunscreen. It is only for the girls to do it. And they have amazing skin. I don't know how. We are doing so much and we're like really trying hard, right? But I don't know how are they
Hmm.
managing it, and which is why we're not able to tell them how important it is, because sunscreen is not just helping you tropically, right? It is also helping
Hmm.
you save yourself from skin cancer, and I don't know, so many things. So I don't know if you want to
Yes.
bring light to this, especially for my male viewers, that even they need skincare.
Yes, see, what happens is that genetics is a very important influencing factor when it comes to the quality of skin. So, yes, maybe your friend has nice genetics. And then another thing that we need to consider and acknowledge, in fact, that male skin is quite different from female skin. Okay, so male skin, it is thicker, it produces more oil, and in male skin, there's more collagen. The collagen loss with age, it is also substantially less than that in females. So males have truly been blessed in that regard as well.
Okay.
So yes, a man's skin might look better with less work, but when it comes to women's skin is more sensitive. It has to be handled gently, and another thing is that women's skin, it is thinner, and it tends to age faster. So definitely, women need to take care of their skin more than men. But at the same time, it's not like that men do not need any sort of skincare. They definitely can keep their skincare simple, but they need skincare nonetheless. So your friend might have nice skin because of genetics, but that does not happen with all of the men. So yes, definitely. Even if you are a man, you should take care of your skin. You should apply the basic moisturizer and sunscreen. You do not need to use a very complicated skincare. You can just do the basics and make sure that your skin stays healthy and that you have a radiant and glowing skin.
Clearly, yes. I'm going to take that as a feedback as well. Doctor, I think one last question that's coming to my mind again is acne also genetic? Because you just spoke about genetics. Is acne also genetic for few people, and how should they deal with it?
So yes, there can be a genetic predisposition. It does not happen in all of the patients, but it can be there in some of the patients because there have been studies which have proved it to be right. And even in our practice, we come across patients who come with severe acne, and they tell us that their mother or their father also had severe acne back in the day. So that is something that can happen. But even if you have a very strong family history of acne, severe acne, if you start treating acne in time, you can definitely prevent the scarring sequelae that maybe your parents had to suffer from because there were not enough resources back in the day. So, yes, you can change the outcome by starting the treatment very promptly.
Okay. All right. Thank you very much for that. And I don't know if we have any more questions in the chat window, but anything else, Doctor, that you want to highlight in the closing that you feel we've not covered in this session?
I think we've covered most of the topics, but there's definitely a lot that we have not yet covered, maybe some other day. But what I would like to tell my viewers, your viewers today, is that having acne is a very difficult thing. It takes a toll on your mental well-being. It definitely, it is very difficult. It is very stressful, and it's okay if people around you do not acknowledge it, but do not beat yourself down. It is hard on most of the patients, and if it is hard on you, you're not any different. But acne will not last forever. Okay, so if you have the resources to seek treatment. If you do not have the resources to seek professional help, then do whatever you can, but do not beat yourself down. Do not stress yourself. It will not last forever. There will be better days. You will have better skin in the future, and just stay hopeful.
Clearly, that's why we are here calling ourselves the beautiful spotless skin team. We're here to get you all the doctors whom you need to have that flawless skin that you're dreaming for. And I like that, doctor, that you mentioned that acne is not going to be forever. You can treat it, you can get rid of it. With that, Doctor, I'd really like to thank you for your valuable time for this session and sharing so much of information and insights about acne, about its management, different skin types. And I'm sure my viewers got a lot of insight and information from you, and especially all the topics that we covered across acne. So, thank you very much, all the viewers as well, for tuning in. We really look forward for many more such sessions for our viewers in the coming time. Thank you very much for participating with all your questions. And with that, stay connected on our beautiful Spotless Skin page. We'll be back again with another show, another expert. See you soon. Take care.